Back pain affects 80% of Americans at some time in their lives. It comes in many forms, from lower back pain, middle back pain, or upper back pain to low back pain with sciatica.
Well, back pain can present in a lot of different forms. Sometimes patients come to me, they describe a deep ache. Sometimes they'll describe stabbing pain, throbbing pain, burning pain. So the character of the pain can be quite variable as the location. Sometimes it's on the left side, sometimes it's on the right side. And occasionally it can be accompanied with pain going down into either leg. The natural history of back pain is that people get better. If you have an acute lumbar strain with some rest, maybe some anti-inflammatories, over-the-counter medication, and activity modification, the vast majority of people will get better over 4 to 6 weeks. If your back pain persists beyond that point, or if your back pain is incapacitating, is constant, or if it is associated with pain, numbness, tingling, or weakness radiating into either leg, that may prompt you to seek medical care.
Okay, Mr. Gordon, have you come on in, lie down on your back?
Common back pain causes include nerve and muscular problems, degenerative disc disease, and arthritis, and is difficult to diagnose.
Well, generally, back pain is a very complicated diagnosis to pin down because there are a number of different structures in the spine that can cause pain. The bones, discs, ligaments, tendons, joints, and muscle. And you have each one of those 6 components in each of the 5 segments in your spine. So it can be any of those number of structures. And we have diagnostic techniques to try to determine which of those is causing your pain.
You pull your ankles up and keep
Virtually everybody is at risk for back pain. In fact, the statistics are that during your lifetime, 4 out of 5 people, or 80% of people, will have back pain severe enough that they will have to seek medical care.
Many people find relief from symptoms of back pain with a combination of pain medication, rest, and physical therapy.
The least invasive form is just rest. Form of treatment is rest. If you injure your back, you rest it, there's a good chance it's going to get better on its own. Then you can try some over-the-counter medication, either an anti-inflammatory or Tylenol, oftentimes is effective. Activity modification, those are the simplest things you can do to try to treat back pain. If that doesn't work, then you probably need more of a supervised program. And the mainstay in my practice for people who have back pain is physical therapy. And the physical therapy can take 2 forms. It can take a passive form where things are done to you, such as ice, heat, various modalities such as ultrasound, and then a more active program where you're doing exercises to build up your core, to increase or improve your aerobic conditioning. Acupuncture is an excellent adjunct to physical therapy. We have an acupuncturist at Desert Orthopedic Center, and in combination with a lot of the physical therapy that we provide and some of the over-the-counter medication that I described, acupuncture can help accelerate your recovery.
When pain medication, rest, and physical therapy don't help, additional intervention to determine causes, as well as surgical and non-surgical treatment protocols, may be necessary.
If these non-invasive procedures don't work, then I think it's time to take a closer look. And there are a number of advanced imaging studies that we have available. We have MRIs that are excellent in demonstrating soft tissue lesions, such as a herniated disc. We have CT scans that are much better in terms of any type of bony resolution. So if you have a bone spur, a CT scan can work. We have a procedure called a SPECT CT scan, which is a combination of a bone scan and a CT scan, which can also help localize sources of back pain.
If surgery is needed, the Spine Center specializes in minimally invasive procedures, allowing for shorter surgery times and a faster recovery.
Well, we have a lot of minimally invasive procedures that have been around for a while, but we just do them through smaller incisions. We use microscopes frequently, use very small incisions. We have techniques to help spare motion as opposed to eliminate motion. We've done cervical disc replacements here at Eisenhower. We're part of an IDE study, investigational device exemption study that's sponsored or overseen by the FDA to perform facet joint replacements. There are some disease processes that we have to treat surgically that require removal of the facet joint. And up until now, if we remove the facet joint, we had to basically do a fusion across that segment. That includes rods and includes screws. And fusions are good surgeries, but the problem with a fusion is that it may accelerate the wear at a level above or below where the hardware is located. Well, what we're able to do now through this investigational device exemption study is we can do a facet joint replacement. And instead of having the rods connect to the screws, the rods actually connect to the centerpiece, and it allows motion across the facet joint. So you can actually see the motion here across the joint when the patient flexes and extends his or her spine.
At Eisenhower Desert Orthopedic Center, newer treatment options are available for compression fractures, which are very common in older individuals.
Vertebroplasty or kyphoplasty is really the same type of procedure. There's a little bit of a nuance between one versus the other, but it's a minimally invasive way of treating compression fractures. We see patients in the Coachella Valley that have compression fractures frequently, and these are fractures involving the vertebral body. They usually occur in an older patient population that has osteoporosis, and it can occur with minimal trauma. And what we're able to do is to, through very small cannulas, pass a bone cement into the fracture and eliminate the pain in about 5 or 10 minutes worth of surgery.
Eisenhower Desert Orthopedic Center's Spine Center is equipped to handle all aspects of surgical spinal care with a multidisciplinary approach involving surgeons, pain management specialists, and physical and occupational therapists.
We provide physical therapy. We have an MRI on site. We have an acupuncturist. We have an anesthesia pain specialist. We have an outpatient surgery center, and then we have surgery as well. So what we try to provide is one-stop shopping. So if you have a problem with your back, all you have to think about is Eisenhower Desert Orthopedic Center, and we'll make sure that you're directed to the proper care provider.
Eisenhower Desert Orthopedic Center's Spine Center is constantly evolving, along with advances in the field of spinal care.
What's really exciting for me as a spine care provider is the dynamic nature of spinal treatment. There are things that I'm doing now that I didn't do 3 or 4 years ago, and I'm sure there'll be things that I'll do 3 or 4 years from now that I'm not doing right now. So that always keeps me on my toes.
Up next, learn about robotic partial knee resurfacing, an innovative procedure for patients with joint degeneration of the knee.